I want to return to something that I touched on several weeks ago, and it's now reaching a crucial point. That's the World Health Organisation's pandemic treaty. Australia, along with 194 member states, are set to take part in the World Health Assembly, which kicks off on the 27th of May, so that's Monday. At the meeting, there will be a vote on two contentious yet widely underreported measures. They are amendments to the international health regulations and this proposed pandemic treaty. The irony is that we can't get a serious royal commission in this country into all those draconian COVID measures undertaken by our government, state and federal, but they're willing to sign us up to a new set of rules drawn up by a group of international bureaucrats. I can't believe that. Joining me now to discuss the detail, one of the few politicians who sounded the alarm, Liberal Senator for South Australia, Alex Antic. Alex, I've mentioned how underreported this is. It's not underreported if we look at your speeches in the Parliament, the media you have done. You have been indefatigable. You've managed to bring together a group of around 14 cross-party parliamentarians. You're trying to get the government not to sign us up to this treaty. Update us on that, but give us a sense of what your biggest concerns are here.
Yeah, well, thanks, Peter. And look, thank you for raising the alarm in the orbit of the mainstream media as well, because you're absolutely right. This has been entirely underreported. You know, it seems the domestic mainstream media are fascinated by matters of relative trivia, while the big show is playing out above us at global level. So that is a very important thing. And I've been trying to do the same thing. It's a critical moment because what we're seeing now is effectively a globalist health power grab. I've been calling it a coup d'etat, and that is really what we are looking at here. This is the World Health Organization, which is a UN body under the guise of the World Health Assembly. Australia is one of those 194 member states that is proposing a brand new pandemic treaty. It's been called a number of things, but that's the general name, and 300 amendments to the international health regulations, which in short, and they are very complicated documents, but in short would give the Director General of the World Health Organization the ability to unilaterally declare an emergency, so a pandemic emergency, and fast-track pandemic-related products. And we know how that worked out last time. So this is, and that is the very tip of the iceberg, I must say. This is a very, very significant moment. Australia will ultimately have legal obligations at international law if this is to be ratified. But also there's a significant issue with respect to domestic law. When I was in Senate estimates 18 months, 2 years ago, I asked the Chief Medical Officer, Paul Kelly, why it was that Australians were being stopped from going overseas without 2 COVID injections. And the answer was the Biosecurity Act was amended in order to line us up with our obligations under the then international health regulations, the 2005 versions. And so you can see how, if this is ultimately ratified, there's no real limit to the obligations that will be put on the Australian Parliament to legislate to keep their obligations alive under that international health instrument. So this is a very, very significant moment. It needs to be more dealt with, and there need to be more politicians who are across it. I'm very thankful to the 14 who supported that letter to the Prime Minister, though.
We can see from the International Criminal Court example, and I remember that debate well in the Howard era. I was there, and there were plenty inside the Howard cabinet who did not want to sign Australia up to it. Trust us, it'll be fine. It will never have an impact on a democratic state. That's what they tell you. And of course, now we are 15 years on, and you can see what's happening here with Israel. What I think people need to understand with the process here, Alex, is that these pandemic laws have been drafted by international bureaucrats, all captured by the left. And we will send along to this assembly starting Monday a whole lot of our own bureaucrats. They will get this to the point that it will be signed by Australia, and it won't come into force until it gets rubber stamped through the Treaties Committee. There'll be no debate in the Australian Parliament. There'll be no questions asked of the Australian electorate. Do you want to give away your sovereignty like this? I think people need to understand, unlike the United States, where the treaty has to have a lot more political input, in Australia, we sign off on these things far too readily.
It's exactly right, Peter. And of course, what will happen if it's ratified, and those negotiations are underway, it will start next Monday, the actual voting period for the World Health Assembly. But what will happen is it will have to come through that treaty committee, which is dominated by the left. It'll then come to both houses of Parliament. Of course, that's the excuse that's always used. We're not giving away our sovereignty. The Australian Parliament is sovereign. But as you quite rightly pointed out in your article, those are rubber stamp jobs. These international treaties are always passed by the Parliament. And then it will become law. And this is what we talk about when these pandemics or other emergencies happen. We talk about this turnkey society. People turn around and say, I don't remember ever asking for mandates or for surveillance or for whatever the issue is. And before you know it, those powers have been bricked in. Well, this is what's happening. This is what will happen in the next occasion there is a pandemic or a global health crisis. We will find that we have afforded the international health bureaucrats the luxury of telling us what to do when local doctors get silenced and criticised. And that's what we saw with the APRA regulations in the last period as well. So, of course, when we ask these questions in Parliament, during Senate estimates, we're told by health bureaucrats that it's all fine. Of course they'd say that because they're dealing with giving powers away to global health bureaucrats rather than local health bureaucrats. I mean, Australians do not want this, I can assure you. This has been a real sleeper issue. People are telling me in numbers I haven't seen for a long time that they are very worried about this. Prime Minister needs to pull out.
Keep the pressure up, please, Alex Antic. Keep the pressure up. It's incredibly important. Thank you for your time. I have to say, having lived through the Daniel Andrews experiment in Victoria, all those lockdowns for the 2.5 years, that makes this treaty would make Andrews seem like an absolute teddy bear.